Real quick, the cooperative, you used the word navigator twice tonight, and I feel that the insurance companies are trying to use that term as well, and they don't navigate the whole system. And I think that's a short-term problem that should be addressed, because I think it's scaring people away, or they're not getting enough information. So how do we drive them to overarching groups such as what you're doing?
And we actually, the ACA calls them navigators. They're actually called health coverage guides in the state, because we also have, there's all these confusing names out there. We've got patient navigators that help in the hospital systems, and then we've got the insurance navigators that are working with us. So we call them health coverage guides. We have a huge uphill battle with the public in terms of A, we exist, B, we're not the devil, and we actually have something potentially that could be exciting to offer to consumers. And so I hope that you've seen our ads. I hope that you've seen us on light rail and on the billboards and on TV. We're really trying hard to penetrate beyond that initial sort of reaction, which is, ooh, I don't like this, I don't know what this is. It's scary, to, this is something that I might want to check out. And then we're trying to make our resources available to people. And a lot of that on-the-ground support, because most people need to sit down and really work through this. It's a complex product. They don't know exactly what this is, and it's scary. Insurance is scary. It's a complex product. So, but yeah, we have a lot of, our branding and the way we're talking about this there's a lot to do, and it's going to take some time.
Okay, so we're going to we've got two people here with questions who are in my blind spot. So we're going to let them pose their questions, and then we'll go down the line for the closing remarks. And if they can incorporate answers, that's great. And if not, you can stay afterwards and we'll get it. What's your question?
My question is to Senator Irene. Your colleagues in the Senate, particularly on the Republican side, do you think if they heard from their constituents, that they would respond differently? Is that they're just not hearing, and who they're hearing from are not, behind this kind of action?
Okay.
But if they actually heard from constituents.
Good question. And
yeah, one of the things I like, of the many things I like about universal and similar health care, is that because everybody's in the pool, becomes a huge incentive to do preventive care. And I'm wondering if there's any provision in any of these measures to include preventive health care, nutrition, and that sort of thing that shows promise of improving outcome and lowering cost.
two great points, I think, to raise, and I think a little bit of an answer is that there is, and that they would. Let the panel take this on, and make your closing statements in 30 seconds. But what I also wanted you to include in that, and I think some of this addresses that, is you've got a group of fantastic people here who are dedicated to healthcare and who came through the cold and snow to be here and give you their input and hear from you, and are, I think, eager to go out and act after tonight. So if you have anything that what people here can do to help in the next step, that would be great. But whatever you want to close with for 30 seconds to a minute.
I mean, just from my perspective, I think, to Tara's point, I think this is a state-to-state exercise at this point. I think Colorado has an amazing opportunity to make a difference in the health reform discussion. And www.connect4healthco.com. Go there, tell your friends about it. I think it's important that we help each other understand what's available in the state today, what the access points are, and help people understand that they can get coverage. It's a guarantee issue market, no pre-existing condition exclusions anymore. There's some really fabulous things that came through the ACA, and I literally have to focus on what we're trying to implement right now, and that's my role in all of this, and I'm really proud to be a part of that.
I agree. I think the Affordable Care Act is better than what we had before. It does force insurers to provide a lot of preventive treatments, free tests and stuff that you had to pay for before, you can now get free. So that's in there. It's not the answer. And anybody who wants to sit back and say, gee, we passed the Affordable Care Act, so we've taken care of it, is not the answer. And Americans know it's not the answer. I think this is a huge opportunity for Democrats in the next 2 elections to say we're going to improve on it, because our goal is to get every American insured.
So I will say, Obamacare does have some good things in it. It's not the answer. I think the concurrence is there between me and TR. The exchange we're at sustainability numbers for the exchange, but the system itself is not sustainable. We haven't fixed the costs. I just want to put this idea in people's head, because I don't hear people talking about it. If Affordable Care Act keeps insurers at a certain medical loss ratio, meaning they have to pay 80% of the money they take in for care. So they're locked in at 20%, which is where they pull out all of their administrative overhead, all their profit, everything else comes out at 20%. They have to take everybody else. Well, they're focused on profit. It used to be they used to get rid of people that cost a lot of money to boost their profit, but now they have to keep those people, right? So where do they get a bigger profit if their profit comes out at 20% of a slice of a pie? No, they need a bigger pie. You know, there's a giant macroeconomic perverse incentive for all of healthcare to cost more and more and more, because if the pie's bigger, 20% of that bigger pie is bigger profits for them. So there's a fundamental macroeconomic problem at stake and at play that nobody's really talking about. Just put that in your mind, think about it. I don't know, we just talk about that offline, because I'd be curious to hear other people's thoughts on that.
So, I think that Colorado is already a leader in healthcare, and we have the opportunity to build on that further. I actually will be doing a number of things this issue to address some of this session, to address things not addressed, including administrative simplification, cost containment, and workforce development. But I think that it would be great if you're interested in this, if you would become engaged with Healthcare for All Colorado or Cooperate Colorado, and help us figure out how to continue to spread the word. If you have relatives or small towns you'd like me to visit, let me know. I've gone to about 8 already, and I'm continuing to go around, because I think that it's going to be everyday people who make this happen, and not politicians. So thank you for your engagement.
Well, and thanks so much for this panel. This was my dream team of panelists, and with Patty Fontenot and Lindy pinch hitting for it was my first choice. My first 4 choices were all able to do it, so I'm so grateful for you all for having this fantastic conversation tonight. Don't forget to visit with the folks from Advanced Patient Advocacy who are talking about the Connect for Health Colorado and Healthcare for All Colorado, the back tables here. And if you're interested in seeing more on this or sharing tonight with your friends, we've videoed as much of it as we could fit on the camera, and we'll have that up at owenperkins.org in a couple of days. It takes a long time to upload, but you can look for it there. All right, well, thanks so much, everybody, for being here tonight, and we'll continue the conversation.
So now